it's Dr. Joyelle, and welcome to the Women's Health Pearl Show, where we have real talk about real women's issues. And today we are going to talk about the skin, our largest body organ that really doesn't get much attention. But as we get older, as most of us or a lot of us know, that our skin becomes drier, becomes thinner. We have those worrisome or just annoying acne breakouts. And we want to talk about why that's happening, especially as we're going into perimenopause and menopause. So I'm excited to welcome Dr. Katina Miles onto the show. She is a board certified dermatologist and the owner of Skin Oasis Dermatology. Welcome, Dr. Miles, to the show.
Thank you for having me. This is so great to talk about women's health. Thank you so much.
You are welcome. Excited to have you. So I'm going to just jump right into it, a thing that I struggle most with, and that is acne. So I have to admit, I really didn't have a skincare regimen until I got into my 40s, because when I was in my teenage years, I had acne issues and it kind of cleared up. And then as soon as I hit 39, it came back with a vengeance. So I was kind of scrounging around to figure out what I can do to help improve my acne. And, I came up with a skincare regimen. So I wanted to get your thoughts in regards to what kind of ingredients or what kind of skincare regimen a woman who was entering their 40s, going through, these hormonal changes, ingredients they should be looking at when they're looking at skincare products.
Believe it or not, most of my acne patients are 35 and above, and it's just because our hormones, at that time, our hormones are changing, and acne becomes more severe and more difficult to treat. So a regimen is super important to be on. Every woman needs to be on an alpha hydroxy acid cleanser, a retinol or retinoid, a vitamin C serum, and a sunscreen. And those are the basics of skincare. A vitamin A cream is really great. That's going to help with exfoliating the skin correctly. It's also going to help with fine lines, wrinkles. It keeps your skin in a healthy state. A vitamin C serum is our antioxidant. That's what helps to protect us from the environment. And your sunscreen, that again protects us against the sun because that is what causes premature aging. And that regimen, if you're consistent with it, that will help to keep your skin under good control. It'll also help to reduce that acne.
Okay, great. So you mentioned retinol. Now, the skincare that I use has bakuchiol in it, which is a plant-based retinol. Have you heard of? I know it's something that's not new, but are you familiar with that? Is that something that you have mentioned to your clients, or something that is also a good equivalent to retinol?
I actually don't use it often in my office. It's a good alternative.
Okay.
That is a vitamin A based cream. It's going to help to correctly exfoliate the skin. I think where we run into trouble is everyone wants to exfoliate with the scrubs and the spinning brushes, and those actually can cause additional acne when used too often or used incorrectly. So your retinol, regardless of where it's coming from, is going to exfoliate your skin correctly and keep your skin in this optimal health.
Okay, that makes sense. Okay, great. So yeah, like you mentioned, hormonal fluctuations certainly can exacerbate or increase acne in women, especially at this stage of life. And when what's happening is our estrogen levels are, as they're decreasing, other hormones or androgens like testosterone are increasing in numbers. So that affects our the sebum of our skin. It can cause oily skin and things like that, and basically end up with acne breakouts. So it's definitely something that is common, and like you said, just kind of figuring out a good skincare regimen is important. And I wanted to also ask you, I'm also very vigilant about talking with women in regards to just natural things or things, lifestyle changes that we can do to address, helping our skin be better. And, one of those things is definitely hydration, important. in regards to, I usually recommend, drinking half your body weight every day, which is sometimes a struggle for me. But, I know hydration is very important. What are some other things that women at this stage of life should think about in regards to what they're eating, as far as their diet, things they should potentially avoid, or things that potentially can actually help their skin to glow?
So you said it, water is super important. I tell my patients sugar is the enemy. So sugar actually kind of will help you to have hot flashes. If you love hot flashes, have lots of sugar. So you want to minimize sugar, dairy, processed foods. Those are things that will cause inflammation internally, and inflammation internally comes out on the skin. So you want to make sure that you have a clean diet. You want to make sure that you're getting adequate sleep and exercise. And those are the best medications that we can give you: proper diet, exercise, and sleep. And that's going to help you to glow, give you great skin.
Those are great points. Like I said, diet, exercise, and sleep. Those are the major things that all of us need in regards to healthy skin and just healthy body in general. And you mentioned, like I said, hydration is definitely important. And I also, you mentioned sugar being the enemy. Definitely, sugar is a big trigger for a lot of other menopausal symptoms. And just personally, I want women to know that your body does change as you get older. Like, before, dairy was not an issue for me, but as I've gotten older, I have noticed when I, have a lot of dairy intake, I have more acne breakouts. So that's certainly something that women need to be aware of, that their body does change, and they need to kind of listen to their body and figure out what things, could be triggering their acne breakouts. Now,
And
the other thing that happens as
sorry. Oh, I would just say I'll share myself. If I have my favorite banana bread from Starbucks, I'm gonna get an acne bump.
yes,
So diet is really important. That sugar intake really can affect the skin.
right, right. Right. So the other thing that happens as we're getting older is that we're losing collagen. As our estrogen is decreasing, we're also losing collagen. And that collagen is basically that the loss of collagen causes our skin to be dry, it becomes thinner. So what are your recommendations in regards to a good moisturizer in regards to our skin?
So a good moisturizer would be like a nicotinamide, like a vitamin B3, that actually helps to hydrate the skin. I'm a big fan of hyaluronic acid that actually helps to hydrate the skin. Hyaluronic acid adds water underneath the skin, and water plumps when it's underneath the skin. So hyaluronic acids are really great. When you're using that retinol, believe it or not, that retinol is helping to increase your collagen output on your skin. So retinol is just great for everything, and also your vitamin C serum.
Oh, okay. That's a good point. I didn't know that. All right. Going back to when you mentioned exfoliation. Now, what is the recommendation in regards to how often should women exfoliate as far as their skin? Is it something that you should do, twice a week, or something that you do, every other day? Like, what is your recommendation in regards to that?
So if you're on your retinoid or your retinol, that is your exfoliation, believe it or not. You really don't need any additional mechanical exfoliation. And if you do want to exfoliate, it should be a scrub that is not very coarse, but a mild scrub. If you want to use that Clarisonic brush, it shouldn't be on the highest DEFCON levels, and it shouldn't be every day. That should be maybe once a month. And it should be to give your skin like a nice glow. And you should do that after you have been on your retinol for at least 2 to 3 months, when your skin has really gotten used to that. But if you're on a good skincare regimen, that is your exfoliation daily. You really don't need to exfoliate.
Okay, those are great points. One other question, chemical peels. I've heard women, mention those, or I've basically kind of read somewhere that chemical peels can potentially help. Can you give me your thoughts in regards to a chemical peel and that helping with, kind of maintaining your skin?
So I love chemical peels. I love the peel. There's different types of chemical peels. There's salicylic acid, there's glycolic, there's TCA. So there's different peels that we can use to help to optimize the health of your skin. For me, I do my chemical peels quarterly because I've gotten my skin to where I want it to be. When we're in the process of trying to heal the skin from acne or from dark spots, a lot of times chemical peels on a monthly basis, every 4 to 6 weeks, and that will help with the skin to get to its healthy state. And then again, you want to maintain with a quarterly chemical peel. But those are great. You do peel, as the word says, for a good week or so, depending on the peel. And that helps with fine lines, it helps with wrinkles, it helps with acne and those dark spots.
Okay. Well, I guess I need to schedule a chemical peel then.
Sure.
Okay, so the last thing I wanted to bring up, I also want women to know, we talked about diet, just kind of being aware and be intentional about what we're putting into our bodies that can affect our skin. The other thing is birth control. You mentioned you have a lot of clients who are 35 and older. A lot of these women are, still need birth control. So I want, women to know also sometimes the birth control can be the culprit of their acne, being more active or just being more frequent too. And I personally also have struggled with that. So what has your recommendation been for women who are on birth control? Are there certain ones that you would recommend women to switch to kind of help, act acne breakouts, or some ones that you actually recommend them, go on to kind of help decrease the frequency of those breakouts?
So birth control that I love for reducing acne, Yaz and Yasmin. Those are my favorite. However, with women that are 35 and above, if they're smokers, then there have been reports of increased risk of blood clots. But
Right.
those are the best ones, I think, for acne. One birth control that I can guarantee acne is Depo-Provera. So if someone has severe acne and the medication isn't working, then I normally say you may want to consider switching from the Depo-Provera. One medicine that I do like to give to my patients that are perimenopausal or menopausal is Spironolactone, which kind of works like the Yasmin. And so that's a good alternative. And while you're going through the transition, I have my patients on for 2 to 3 years, and that helps to control that hormonal acne.
Okay, those are all great points. Well, thank you so much. I really appreciate you coming on the show. We'll have to have you come back on to talk about something different, probably something like hair loss.
Oh, absolutely.
Having a good skincare regimen is important, like Dr. Miles mentioned, good cleanser, moisturizer, and sunscreen, and your water. Those are the things that are very important to maintaining your skin, and exercise and sleep. So don't forget those also. So until next time, I want to thank everyone for tuning in to the show. This is Dr. Joyelle. Remember to follow me on IG and Facebook to find out what we'll talk about next on the Women's Health Pro Show, where we have real talk about real women's issues.